Good afternoon, NCRGA members and guests. Welcome to today's webinar, Medicare Open Enrollment Period 2025. What do you need to know to prepare for 2025? Presented by Jeanie Schepisi, SHIIP Field Operations Manager. I'm your host, Daryl Davis Balmer, and today we'll also be joined by Tim O'Connell, NCRGA's Executive Director, who will share the update from the association. I also want to thank Tracy Eubanks for your technical support today. Our primary presenter, Jeanie Schepisi, oversees the Seniors Health Insurance Information Program, that's SHIIP, Regional Manager Team, and is responsible for coordinating statewide partnership efforts. As the Central Regional Manager, Jeanie supports Alamance, Caswell, Chatham, Davidson, Forsyth, Guilford, Randolph, Rockingham, and Stokes counties. Jeanie, I don't know how you do all of that, but anyway, she recruits and trains SHIIP volunteer counselors and county coordinators. She also provides outreach through speaking engagements, exhibits at conferences and health fairs, and radio and television appearances in the 9 counties that she supports. So before we began this webinar, I want to go over a few items. Each of you has been muted to help ensure the presenters can be heard. The webinar will be recorded and posted on our YouTube channel. We'll also send out an email to everyone with a link to our YouTube account and announce it on our social media sites. For those of you who sent questions, we submitted them. However, many of you submitted questions that were more personal than general. So some of them may be answered to the presentation, but we will send out some links following the presentation so you can contact folks directly who can actually answer the questions that you've asked. If you think of a question, however, during the presentation, please use the Q&A button at the bottom of the Zoom page. We will read them at the end so that she can respond. So without further ado, here's NCRGEA's Executive Director, Tim O'Connell. Tim, take it away.
All right. Thank you so much, Daryl. It is great to be here today. And what a crowd we have for this program. I know there's a lot of interest in this topic, especially this time of year with open enrollment coming. So we are so grateful for Jeanie for making time for us and for you so you can get the information to make the best choices you can for your healthcare needs. I'm going to share a couple items just from the world of NCRGA so you know what's going on. And I will actually be monitoring the chat room. So if you have any questions for me, please go ahead and drop them in the chat. I'll answer them as quick as I can. I'm also going to be helping Daryl out in feeding questions to Jeanie as well. So I may disappear for a little while, but I'm going to be in the background. So a couple items that I want you to know about. We just wrapped up our conference in Charlotte. We had nearly 300 members. We packed the house and had a great program. Actually, SHIIP was there with us virtually delivering information, so they did a good job with that. But important things that were at that conference is really there's some big things going on with the treasurer's election. We've got 2 great candidates, and I want you to go to our website and watch the videos from the conference there. Each of the treasurer candidates spoke at that conference, and I want you to make sure you are voting for the candidate you want when you go to the elections, or if you're voting early, doing that. But 2 great candidates, I'll just say that. So go ahead and listen to the words, and you make the best choice for you. But we actually have got a lot of information from them, and I want you to make sure you're looking at that information. The next thing that I want to share with you is what is happening with the legislature. It is a little bit different this time of year. Normally, and there is not much normal right now, but the legislature has something called a short session. The short session sounds like it's just going to be a sprint. It is nothing like that. This year, it is still going on. We are getting questions. Has the budget been approved? Has the budget been approved? The budget has not been approved. What this means is the House has approved their budget. The Senate has approved their budget, but there's not agreement on a joint budget that would then become the budget for North Carolina. So when asked, or is there any money for retirees in there? Just know we are still fighting and working for you on that. There are some call to actions on our website you can still participate in, and there'll be more on that. At the moment, what is in the budgets, the House has a 2% one-time pension supplement. That is a bonus, one time in their budget. The Senate has no money in it for retirees. So I want you to go ahead and reach out to those senators you know and give them a call and tell them how much you appreciate their support of retirees. And if you've got a representative you know or you know who represents you, go ahead and reach out to them and just say thank you and keep fighting for retirees because we appreciate the folks doing that. So that is a quick synopsis of what's going on in the legislature. I've had this question asked, when does the short session end? And you can look this up. It ends when it ends. There is nothing in the statutes saying that it has to end by a certain date. So, I'd say we start wearing our, in our spring colors. And we think we're going to be out by July 1 and cooking our hot dogs. But I'm pulling out my sweaters and getting ready for the continuation of the short session. So know that, but I'll be glad to answer any more questions on that. I have had the question, what about local government? Know that we are working hard on local government. There was a bill put forward. It was House Bill 930. You can look this up. House Bill 930 did have money in it, 3% COLA for both local and state retirees in it. That bill has been stuck in appropriations. It never came out of the House Appropriations Committee. So know that there are folks in there that are really trying to get you a good COLA. And if you want to take a look at that bill, you can look at that and reach out and thank those representatives that put that bill at least on the, brought it to committee. So we're going to keep trying to work with those folks and with everyone. We are nonpartisan and we are just working for you. So I want you to know that. And again, glad to answer any questions in the chat. Looking forward to Jeanie, you sharing. I shouldn't pick favorites, but y'all are some of my favorite people on earth when you deliver this information because we get asked hard questions that we don't know, but you do. So thanks again for being here today, Jeanie. And thanks, members, for being with us.
And thank you, Tim, for that update. And you were answering some hard questions too, because we get a lot of those. So thank you. We appreciate that and all the work that's been put forth to help us to get to this point where we can address that. So now we'd like to turn this over to our star for the day. Jeanie, take it away.
Good afternoon and happy hump day, everyone. And Daryl, thank you and Tim and Tracy for making this Lunch and Learn possible. And I just want to let you guys know that we feel the same way about NCRGEA. I'm a state employee myself, actively employed. And I always tell people what a great group you guys are. I give out your number and your website quite frequently. And when I retire, which, gets closer and closer every year, I want to be a member of NCRGEA. And I know you can join before you retire, but I'm not sure if I'll join before retirement, but definitely when I retire, I'm going to be a member of this group because you guys do great things and you reach a lot of people and help a lot of people. So thank you very much for this opportunity. So as Daryl said, I'm Jeanie Schepisi. I am the Field Operations Manager for the North Carolina SHIIP, SHIIP program. And in that, I manage the regional manager team. And there are actually 5 of us regional managers that take the state of North Carolina in its 100 counties, and we divvy that up. I have the fewest counties, which is 9, and the rest of the 4 regional managers have about 20 some counties because I, in addition to managing the counties that I support, I also manage the regional managers. And so I have personnel things to do and so on and so forth. But they're a great group of people. I don't know of a harder working group of people, and it's a pleasure to work with them, but they take very good care of you guys across the other counties that I do not support. So I am with the North Carolina Department of Insurance. So I do bring you greetings from Insurance Commissioner Mike Halsey and the other Department of Insurance staff. I have been with SHIIP for 28 years in July, and it's a great organization to be a part of. And we, no matter what capacity of the Department of Insurance that is represented, we do serve the people of North Carolina and do a lot of things to help out consumers. And that's what we're here for. So with that being said, I want to give you a very brief overview of the program that I represent, which is SHIIP, SHIIP, the Seniors Health Insurance Information Program. And that is a mouthful, and that's why we call ourselves SHIIP for short. And then I'll talk a little bit about our sister program, the North Carolina Senior Medicare Patrol Program. If you have been to any of the district meetings, as Tim mentioned earlier, we've been participating in these for as long as I can remember. In fact, I actually participated in the RGEA district meetings before I came into the SHIIP staff. I was with Cigna Medicare, which was the Part B contractor, and I did presentations about Medicare at that point. And that's actually how I got to be a staff member at SHIIP. So my history with NCRGEA actually goes beyond my employment with SHIIP and the Department of Insurance for 28 years. So SHIIP is a division of the Department of Insurance. So we are a state agency that receives federal and state funding, and we assist people in a neutral, objective, and unbiased fashion related to Medicare products. That means we do not sell, we do not receive a commission. We tell people about all plans and all companies. We collect sometimes financial information and health related information. And when we do that, guys, the information that we collect is kept confidential. We use it for the purposes that we need, but we do not share that information, in a way that is harmful to you. So please rest assured that we do keep your information personal and confidential. We also provide services at no cost because we receive both state and federal funding to do what we do, and we're very appreciative of those two funding sources. The majority of our funding does come from the federal government because as of 1992, the federal government required that every state in the country has a program to help people with Medicare-related questions, and we have been doing it since 1986. So we've been around for 38 years this month, and we actually were created before the federal government required that we were here to help people with Medicare questions. So we were one of the first states, or the first two states, to help people with Medicare questions without solicitation. And we received state funding from 1986 when we were created to 1992, which is when the federal government passed the law that every state have a program to help with Medicare questions. So in 1992, we started receiving state funding in addition to federal funding. And in 2006, when Medicare Part D was created, then we started receiving additional funding because we are the source in North Carolina that has been tapped by the federal government to help people search for, compare, and enroll in a Medicare prescription or drug plan if that's what they want. So with that being said, I'm going to tell you a little bit about how our program is organized. So we have an office in Raleigh because we are a state agency, and we assist people through our call center. And if you call and ask us a question that we can't answer, we're not the source. We give you an appropriate referral, not the runaround, because we help with many, or we partner with many agencies and organizations. So I tell people, if you're not sure whom to call, reach out to us. And because we work with so many agencies and organizations, for example, if someone asked me about state retirement, then I would refer them possibly to the NCRGEA for assistance. We also act as a clearinghouse. We've got materials and publications that we can send out to people, or we can tell people where to find them on a website, and they can get that information right then and there, and it saves trees and postage. So we can help you find the resources that you need that are relative to Medicare. And then the best part of all about it, we've got a wonderful website, and I'm going to share that so someone can type it in the chat box for you. It's 855-408-1212. That's 855-408-1212. And you all, not only is that the SHIIP number for Medicare questions, but it's a Department of Insurance number. And if you have any insurance related questions as a consumer, life insurance, homeowners insurance, automobile insurance, then you may call that number Monday through Friday, 8 a.m. to 5 p.m., and someone can assist you with your question. We also have a wonderful website at SHIIP, which is www.ncgpa.org. SHIIP.com, and you can access that anytime, day or night. And we feel like the information is very easy to locate, but if you can't find what you're looking for, please give us a call and we will try to help you navigate our website so that you can find what you're looking for. We also have local coordinating sites, and this is what makes our program special and unique here. And while there is a program in every state to help people with Medicare questions, and there's basic parameters or guidelines for those programs, ours is a little different from maybe some other states in that we have a coordinating site for our program in most of the 100 counties. So if you call our office in Raleigh and we aren't able to assist you with what you need, we feel like you need someone to sit down with you face to face, or they can meet with you virtually. Remember, our services are provided at no cost. Then we would refer you to your local county coordinating site. And when I pull up our SHIIP website, I'm going to show you how to find that information. So call us toll free 855-408-1212, Monday through Friday, 8 a.m. to 5 p.m. And if we are able to assist you through our call center, we're happy to do that. But if we feel like you would best be assisted by speaking to someone locally in your county, then we're going to help you find your local SHIIP coordinating site so that you can call and make an appointment there to meet with our certified SHIIP counselors, and they are volunteers. Most of our coordinating sites are senior centers, councils on aging, retired and senior volunteer programs, Shepherd's centers, cooperative extension offices, maybe the area agency on aging. So we can tell you whom that source is in your county if you want to reach out to them and speak to someone there directly. It's a great service. We help answer general questions. We help answer detailed specific questions. We've helped people save money. We want to make sure, our goal at SHIIP is to make sure that you as a Medicare beneficiary have the best coverage at the best cost. So that is our goal, and that's what we're here for. So please reach out to us. We also have a sister program called Senior Medicare Patrol, and just like every state has a SHIIP, SHIP, to help people with Medicare questions, every state has a Senior Medicare Patrol to help people know that there's Medicare fraud and abuse out there. We like to think that everyone's wonderful and they do good things and they do the right thing all the time, but that sadly is not the case. So for that reason, every state has a Senior Medicare Patrol. In North Carolina, our Senior Medicare Patrol is known as NCSMP, and it's based within our SHIIP, which is based within our Department of Insurance. So you can reach SMP by contacting the same number that Tracy has put in the chat box there. We remind people through our Senior Medicare Patrol program to protect your Medicare card. And even though your Medicare number is no longer a Social Security number as it used to be in the past, it is still a number that if someone gets their hands on it, they can file fraudulent claims on your behalf, and we don't want people doing that. So protect your Medicare number, even though it is not a Social Security-based number anymore, like you would your debit or credit card. Never give it out over the phone, and if you're giving it out, make sure you understand what that person that's asking for it is going to use it for. So protect that Medicare number. Detect. When you're checking out of your doctor's office or from the hospital, you're being discharged, always ask for a copy of your statement, of an itemized statement of what was done to you, when it was done, and what the charges are. And then when your insurance statements, Medicare supplements start rolling in, then you can compare the statement from your Medicare plan to your statement from your healthcare provider to make sure that everything adds up. You can't really compare everything if you don't get a statement. And many times when you check out, they don't give out statements anymore unless you request or ask for one. I used to work in a doctor's office back in the mid to late 80s and early 90s, and we just gave a statement out to everyone upon checkout, but they don't really do that anymore. So please ask for a statement of what was done to you before you leave that provider's office or that healthcare facility. And then look at those statements and make sure that everything matches up. If something doesn't match up or something doesn't look right, listen to your intuition. Call that healthcare provider and question. Call your insurance company or Medicare and question. And if it's a simple billing error, maybe they can resubmit it as a corrected claim. Or if there was a true billing error, hopefully that will be corrected. If you still feel that something's not quite right, because there are healthcare providers that are committing fraud and abuse. There's insurance companies that are also committing fraud and abuse. So you have to be your own advocate. You have to look out for yourself. And so if something doesn't feel right after calling your healthcare provider or your insurance company, then you reach out to the Senior Medicare Patrol Program, which is within our SHIIP in North Carolina, and you do the third thing: protect, detect, and report. If something happens to you and it's not reported, it's probably happening to other people as well. And someone needs to report it and stop it, because $68 billion was wasted last year in healthcare fraud and abuse in the Medicare arena. And we don't want that to continue. We want Medicare to be around for many, many years. So please protect your Medicare card, your Medicare number. Detect by looking at your statements like you would a debit or credit card statement. Question, make calls. And if you still feel that something's not right and you're not satisfied, report. And it may only be $1, you all, but here's what I tell people. If everyone in the country that's on Medicare is wrong by just $1, think of the impact that that would make. Excuse me. So please do your part in keeping your eyes and ears open. And younger people these days say, if you see something, say something. So if you see something and you don't feel that it's right, please say something and report it. We need your help, and we do want to protect the Medicare system. So the next thing I want to talk to you guys about is, no matter how you have your health insurance, you have preventive services that are covered. And whether you have Medicare or an active group health plan, or you've got a Medicare product that's not the state health plan, or you do have the state health plan, please take advantage of the preventive benefits that are offered and that are covered. Under Medicare, most of those preventive services, you don't have a deductible to meet, and then there's no copay. So there's no cost out of your pocket. So I can't afford preventive services should not be a valid excuse. If you take advantage of these preventive benefits that are offered by Medicare, it's like taking your vehicle to have it serviced every 3,000 or 5,000 miles. Hopefully, if you go in, they're going to say everything looks great, come back in another 3,000 or 5,000 miles. But if they do catch something because you're going in on an annual basis, hopefully they catch it soon and before it advances, and they are able to treat it and save your life and keep you healthy and well. So please take advantage of your preventive benefits, no matter how you have health insurance, because usually there's very little cost out of your pocket associated with those services. I know in the Medicare New Handbook, it is outlined on pages 30 to 55 with a little blue apple icon as to which preventive services are covered and how they're covered. So please check into that. I also want to let you know that if people have limited income and resources and assets, there are assistance programs under Medicare for both the medical side and the prescription drug side. And every client that we touch at SHIIP, we ask about income, resources, and assets. And that's not to be nosy, but it's to see if they may qualify according to the guidelines and the parameters. And if we feel that someone may qualify for some assistance, either through what we call extra help for Medicare prescription drug coverage or a Medicaid related program for their medical benefits, we can help with those applications right then and there, making it convenient for people. They don't have to fill out the application themselves. They don't have to go to another agency or source. We can do it for them. So we are always going to ask about income, resources, and assets so that we can help people qualify and apply for those programs. The next thing that I want to talk about is why we're here today, Medicare open enrollment. And you all, it's an exciting time of the year. The fall is exciting. It's cooler weather. The leaves are changing colors, and lots of good food during the fall. And it's pumpkin season. And so with that comes exciting information for health insurance recipients as well. No matter how you have your health insurance, if it's an employer group health plan or some type of Medicare product, the law requires that your current insurer send you information about your plan for next year, what it's going to be like, the benefits and the cost. So I want you to keep, again, your eyes and ears open. We've been told that people are getting their Medicare and You 2025 handbooks already. Those are mass mailed the middle to the end of September. And there's one per household. So if you're married and living with your spouse, you either have to fight over it or share it. But that information is going to come out to you. If you've elected to get your Medicare and You handbook electronically, you probably already have received that via email from the federal government or the Centers for Medicare and Medicaid Services. I want to talk a little bit about that Medicare and You handbook. It is your owner's manual. And I know it's about 120 some pages. It is not to sit down and read from front to back cover. It is a reference guide. It's not a novel. It's a reference guide. And so I want you to start looking at that handbook differently when you receive it every fall. First of all, as a consumer who pays taxes and they use tax money to print the Medicare and You handbooks, I want you to think the government put a lot into printing and mailing this publication, and I'm going to keep up with it. When I get my decision guide from the state every year, I have a specific place that I place it so that I know where it is throughout the year in case I need to refer to it. So when you get your Medicare and You handbook, I want you to put that somewhere special. I also want you to look at page 2, the inside front cover, because that's where it tells you of the things that are new and important to Medicare for next year. And I want you to kind of skim over those things. And under every heading of what's new and important, it even gives you the page number to refer to. So you can't beat that. It can't get any easier than that. So as a Medicare consumer, because you paid into Part A when you were working, you probably pay a premium for Part B when you go on Medicare Part B. So I want you as a smart consumer to look inside on that front cover to see what's new and important for next year so that you are in the know with that. On page 3, there's a helpful table of contents that tells you of the different sections that are in that handbook. There's a section on original Medicare. There's a section on Medicare Advantage. There's a section on Medicare Part D prescription drug coverage. There's a section on the assistance programs that are available. And there's a lot of information out there. So use that table of contents to find what you're looking for. If you still can't find it in the table of contents, the next few pages contain a very detailed index that's alphabetic, and there's a lot of things listed A through Z, and that's usually where I can find what I'm looking for. Sometimes I know the topics or the sections that are on page 3 in that table of contents, but sometimes if I'm looking for something about healthcare savings accounts or the enrollment periods, then I have to look in that index, and it is very detailed and alphabetic. So you should be able to find what you're looking for there. If not, please reach out to Medicare. The number's 1-800-MEDICARE. That's pretty easy to remember. Or call SHIIP and we can help you navigate that Medicare and You handbook. Most every basic question that I get or general question that I get can be answered by looking in that Medicare and You handbook. And it's like Dorothy. She has those red ruby slippers on her feet the entire time. So she's able to get home to Kansas and she just doesn't know it. There's a lot of answers to your questions in that Medicare and You handbook. So please visit that handbook and become familiar with it. And hopefully it'll be one of your best friends. It is a great resource guide. So it's an exciting time of the year because not only is the Medicare handbook being mailed out, but also companies are communicating with us about the plans that we currently have. And I'm no different, guys. I am fortunately a state of North Carolina employee, and I have the state health plan as an active employee. And a few weeks ago, I know you can't see it exactly, but I just want to show you that I got this postcard about the transition from Blue Cross Blue Shield to Aetna in 2025. So that's one thing that I've received. Another thing that I've received a few weeks ago is a save the date. Now, it's not for a wedding or anything like that, but it's a reminder that since I'm a state health plan recipient or member, that the open enrollment dates for the state health plan of North Carolina, September the 30th to October 25th of this year. So this little booklet is reminding me about the state health plan open enrollment period dates. And then they also give me, because Aetna is going to be the only option that I have. If you're on Medicare, you also have the Humana option, but there is a number for me to call if I need to reach out to Aetna. And the state health plan number is there as well. So this is a good booklet just to get me started. Now, yesterday, and those are a little damp because I was out yesterday in Stokes County and it was pouring rain. But yesterday, when I got home, in my mailbox was my thick decision guide. And this is a great, great resource for me as an active state employee. If you're retired, you may have a different decision guide. And if you're retired eligible for Medicare, you may even have a different decision guide. There's different versions depending on what your situation is. But no matter what your situation is, this is a great, great resource. And I want to remind you guys, this booklet only works if you open it up. There's two little plastic circles that stick this booklet together or hold it together. And so yesterday I kind of slid my thumbnail underneath it and I opened it up. That's the first part of what we need to do. And then I'm going to actually sit down and look at the pages because, guys, there's some really good information in this booklet. We just have to open it up and we just have to look at that. So please promise me that you will do that. It will tell me if I don't do a certain thing by a certain date, this is what's going to happen. Same for you guys as well. And we have the first of every year people that say, oh, I've been moved from this plan to this plan, and I didn't know that was going to happen. Well, guess what? They told us in the decision guide that was going to happen. And if we didn't act or do something, then they followed through with what they told us they were going to do. I don't want you guys to be surprised with that. So please open up your decision guide. And if you are a state retiree of North Carolina who has the state health plan of North Carolina, your open enrollment dates, September the 30th to October 25th of this year. And that's the time frame that you should look at your materials and you should go into Orbit or Beacon or whatever and make those changes to start January 1st. There's a lot of good, detailed, comprehensive information out there for us. You have a direct source, which is the state health plan of North Carolina, that you need to call. If you have general Medicare questions, you may call SHIIP. But if you have questions about the state health plan or you have questions about the state health plan open enrollment period, guys, please go to your direct source, which is the horse's mouth, which is the state health plan of North Carolina. And that phone number is 855-859-0966. That's 855-859-0966. That is the number for state retirees who are Medicare eligible, state retirees who are not Medicare eligible, active state employees. That's our number to call if we have questions and need assistance, especially during open enrollment. I know for a fact, because I visit it frequently, and thank you for typing that number in the chat box, Tracy. The state health plan website is www.shpnc.org. That's shpnc.org. And there's a lot of information. You click on the tab whether you're a retiree or an active employee. And if you're a retiree, it then breaks down into, are you Medicare eligible or not? So there's a lot of good, helpful information out there. And if you can't find what you're looking for, please call the state health plan and let them know. And Tracy, thank you for typing that state health plan website in the chat box. So just to remind you, if you are a state of North Carolina retiree or active employee, and you have the state health plan of North Carolina, your direct source for answers to questions and regarding open enrollment is the state health plan of North Carolina. So please reach out to them. When Medicare open enrollment starts October 15th, and that's about 10 days where the state health plan open enrollment and Medicare open enrollment overlap, we are going to be bombarded and slammed with calls on our call center. And then you may get through just to find out that you needed to call the state health plan. So please call the state health plan directly. I also want to mention that Jane and Roberta with the state health plan are traveling the state doing some in-person workshops. The schedule for that is in your decision guide if you're a Medicare eligible person. So if you can attend one of those in-person workshops, please do. I usually try to attend myself just to hear what the horse's mouth is saying. But if you're not able to attend, there are also some virtual options and some town hall meetings. And I would highly encourage you to participate in those. They're doing those for your benefit. So please take advantage of those. So that's what I wanted to mention about the state health plan. At this time, I'm going to share my screen and go to the SHIIP website. And hopefully you guys can see that. This is what our SHIIP website looks like. So if you are looking for information about Medicare and related to your health insurance offerings, then this is where you would go quickly. And my cursor is a little weird sometimes, guys. So at the top, there's a banner that pulls over and then it moves. You'll see that. There's about 4 screens that pull over in our banner. Number 1, we just talked about Medicare fraud and abuse, and there's a banner for that. We also want to remind you that September is Healthy Aging Month, and you can click on that and find out more information. For people with limited income and resources, there are assistance programs, and for Medicare Part D, that's called Extra Help. And for medical services, that's the Medicaid program or Medicare Savings Program. And then lastly, on our website, when you see this picture with all these people in it, how can you find a SHIIP counselor in your county? And there's about 3 places on our website that you can locate a SHIIP counselor, but I'm going to click on that and show you. And if you pull down, it says find a SHIIP counselor in North Carolina. And if you click there, it's going to allow you to find Alamance through Yancey, the SHIIP coordinating sites in every county. And I will show you Wake, since that's where our office is located and the NCRGEA office is located. And they actually have several offerings. Most counties only have 1 or 2, but in Wake County, there's several senior centers that support our program, as well as our SHIIP office in Raleigh. So it doesn't give the name of our coordinator in case they're not there. If you call this agency and ask for SHIIP help, they should be able to assist you or direct your call to the proper person. So this is how you locate a SHIIP coordinating site in Alamance through Yancey counties of North Carolina. Okay. If we go back, in addition to finding, and you all, we're always looking for SHIIP counselors. You go through an online training program that's a national training program to learn about the basics of Medicare. And then once you've graduated, and you do that on your own pace, once you're graduated, then we meet with our counties in every county in person 4 times a year, just to make sure that they have the updates and changes, because we all know as soon as you learn something about Medicare, it's going to change, especially the first of every year. So we want to make sure that our counselors have updated, accurate information when they're assisting people locally in the counties. We are in need of certified SHIIP counselors as volunteers in all counties, but especially rural counties. I was in Stokes County yesterday, and we only have the coordinator there, and she's wonderful. But when open enrollment comes up, she's going to be very busy. So if you want to learn about Medicare and put back out in your community, I will assure you it's very rewarding, whether you're answering a general question for someone or you're helping them compare plans and you find a plan that's going to give them better coverage and save them money, or if you're helping them to apply for an assistance program and they qualify and you help them save a lot of money that way. It is rewarding being a SHIIP certified volunteer counselor. And I'll show you how you can find out more about that in just a minute. If you want to find out the SHIIP in another state, if you think, wow, this is a great program, and I know people in other states that can benefit from this information, then if you go to our website, click on that box to find a SHIIP counselor, then in another state, and it's going to list them. You have to keep clicking a few boxes, how to find SHIIP in another state. And then we're going to click on the orange box on the next page right here, SHIIP locator. And the reason this SHIIP has one eye, guys, is because every state has a program called a State Health Insurance Assistance Program, and that's SHIIP with one eye. But then we all have different names, and ours is the Seniors Health Insurance Information Program. So we are a SHIIP, SHIP, whose name is SHIIP. So I'm going to click on New York because that's where my husband's family and my in-laws are located, and my father-in-law is actually a Medicare beneficiary. And it will tell you the name of the program. Their program is called Health Insurance Counseling and Assistance, or HICAP. And it has their toll-free number and their website and how you can find them on Facebook. If you want to find another SHIIP, let's look at North Carolina's. And there is our logo. And here's the national SHIP logo. So every state has an SHIP, but every state's SHIP has a different name. And ours is the Seniors Health Insurance Information Program, or SHIIP with two I's. And there's our toll-free number as well as our website. The direct website is www.ncship.com. All right, so now that I've shown you that information, I want to go back and show you a few other things on our website that may be helpful to you. And it takes a few clicks to get back, guys, so just bear with me. And hopefully you've pulled up the SHIIP website before for North Carolina and you've looked at it and you might be familiar with it. Underneath the banners that pull over at the top, the four banners, there's what's called what I call the tic-tac-toe or Brady Bunch board, and there's 9 boxes. And if you are interested in becoming SHIIP certified and helping people in your county with Medicare questions, this is the box that you would click on. There's 3-page duties and responsibilities, and also a 3-page volunteer registration form for you to fill out and sign and get back to your local SHIIP coordinator, and they will get the ball rolling. There is a box for our fraud and abuse program, Senior Medicare Patrol. Here's the second place that you can click to find a SHIIP coordinating site in North Carolina and all 100 counties, as well as in other states. This box has the basics of Medicare A, B, C, and D. This box in the middle where Alice used to be, if you watch the Brady Bunch, these are your Medicare supplement plan information, as well as the plans and companies. There is a box about long-term care insurance. We don't get a lot of questions about that, but there is a box relative to that if you're interested. If you're new to Medicare, and Daryl said, please answer the question. We get it a lot. What if I'm new to Medicare? When do I need to reach out, and whom do I reach out to? You can reach out to us at SHIIP, whether you're a state retiree or not. And about 3 months before you turn 65, or about 3 months before your Medicare begins due to disability, if you're under age 65, is a good time. A year, it's good to be thinking about it then, guys, but that's really too far in advance. But about 3 to 4 months before you turn 65 or go on Medicare disability, that's about the right time for you to reach out, and it gives us time to do what we need to do and for you to do what you need to do. And if you haven't created a Medicare.gov account or a socialsecurity.gov account, I would encourage you to create a Medicare.gov and a socialsecurity.gov account with a username and password. That is very, very helpful to everyone involved. This is about the assistance programs for people with limited incomes, resources, and assets. And you can go there and look at that, but we can help you apply if we feel that you're eligible. And please remember, you all, no matter how you have your Medicare, you are eligible to file or able to file a complaint, and we have a box for that. You can also call our call center and file a complaint verbally with our communication specialist, and we can help you with that. Under this More box, there's a couple of things I want to call your attention to. There's a tab for Medicare for people with disability under 65. Once again, search for a SHIIP counselor, find out the SHIIP in another state by clicking here. And then additional resources. We get asked about dental, vision, and hearing coverage a lot because normally Medicare doesn't cover that under A and B original Medicare. So you can find the dental, vision, and hearing licensed and approved by the Department of Insurance companies under that tab. And then if you click on employer group health insurance for retirees, that tab, it will actually have a way that you can link to the state health plans website. And you can go directly to the shpnc.org website, or you can link from our website by clicking on employer group health insurance for retirees. And we actually even have a couple of the state health plan documents for 2025 already out there and loaded for your assistance. So I'll keep this pulled up, and I do want to talk to you about open enrollment that's coming up for Medicare. So if you have Medicare, let's say you were a local government employee, or you're maybe the spouse of a retiree from the state, and you do not have the state health plan. So if you're not a state health plan person, your local government or the spouse of a state retiree who has Medicare products, then this part is for you. So SHIIP receives federal funding to help people compare and search for and enroll in the Medicare Advantage Part C and Medicare Prescription Part D plans. Open enrollment for Medicare is always October the 15th through December the 7th. It's about a 7-week period. It is short in some ways, but it's very long in some ways. But it's our time as Medicare consumers and beneficiaries to compare our plan for next year, benefits and cost. The government gives us this time, guys, because the plans change every year. So number one, you need some type of drug coverage, even if you take no prescription medications. You need drug coverage just in case your provider writes your prescription, and you need drug coverage so that you're not penalized, accruing that penalty. So you need some type of prescription drug coverage, no matter who you are. But if you're in Medicare, especially, you need some type of drug coverage. You may have it through an employer plan that you used to work for the employer, like the state of North Carolina health plan. Okay. If you don't have that option, you might have TRICARE for life. If you're retired military, you may be eligible for veterans benefits if you were a veteran, and so on and so forth. But if you don't have any of those options, then you should have a Medicare drug plan. People can have both Medicare and Medicaid. Medicaid is an assistance program for people with limited income and resources. If you've got Medicare and Medicaid, Medicaid is the caboose or the payer of last resort. And if you've got both Medicare and Medicaid, Medicaid will not cover your prescription medications if you're outpatient. You have to have a Medicare prescription drug plan, okay? Even if you take no prescriptions, you need some type of drug plan. And this year, there's actually a Medicare drug plan that's a zero premium or has a zero premium. And we would encourage people that don't take any outpatient prescription medications to enroll in that zero premium plan, just so that they have coverage and they're not penalized later on. We will not find out who the Medicare Advantage plans and who the Medicare prescription drug plans are until October the 1st. Now, if you've gotten your Medicare and new handbook already for next year, they are listed in the back, the very back pages of your North Carolina state-specific handbook. But we would not use those pages to compare your plans and to enroll in a plan. That's just a listing. It's not really helpful for you to compare. If you have Medicare and your drug plans through Medicare, not through the state, then you may reach out to SHIIP, our office in Raleigh, our toll-free number, or you may reach out to your local SHIIP coordinating site and make an appointment. And we would need you to bring your current prescription medications. You can get a list from your pharmacy as long as it's your current list, or you can bring your bottles and inhalers and your tubes with you so we can actually see those medications that you're taking. We need to know what you're currently taking prescription-wise as an outpatient. We don't need over-the-counter or vitamins, only those prescribed to you by a healthcare professional. We also need you to bring your red, white, and blue Medicare card. Even if you have an Advantage or Part C plan, we need to see your original red, white, and blue card number to get into the Medicare system. So that's very important. You can call our SHIIP office in Raleigh and we can help you through the phone line, or you can reach out to your local SHIIP coordinating site in your county of residence and make an appointment with one of our certified SHIIP volunteer counselors, and we can help you that way. But if you've got a Medicare drug plan, you do need to compare every year during open enrollment to ensure that you have the best coverage for the best cost, because the plans change every year. The Medicare prescription drug plans that you would have if you've got A and B Medicare with a red, white, and blue card, they're the same all across North Carolina. But if you have a Medicare Advantage plan or Part C, these are plans that combine a medical and a prescription drug benefit. These are your HMOs and your PPOs. Those vary county by county. And so we need to be very specific when we enter your information that we're looking at plans in your county if it's Medicare Advantage. Last week, when I was doing a run through with Daryl and Tracy, I mentioned that Medicare HMOs are a very strict, restrictive circle, okay? It has a definite boundary and an outline. And if you're in a Medicare HMO, it has a network of providers, and for it to work, you have to stay in that network of providers, and we will not enroll you in a plan until you've called and checked out with your providers if they're in network or not. A PPO is a circle with a dotted or broken line circumference. And while that PPO wants you to stay in network, and if you do, you pay your in-network copay, it also allows you the freedom and flexibility of going out of the network. You just pay a little higher out-of-network copay. So network-wise, a PPO is more flexible and less restrictive than the HMO. When we talk to you, we tell you about the different kinds of plans, and we give you guidance so that when we hit that enrollment button for you, you're sure that that provider network's going to work. And you're also sure that the prescription medications that you currently take are covered as well. When you're in an Advantage plan, you've got to look at the provider network, make sure that it works, but you've also got to make sure that your prescription medications that you currently take are covered under that formulary. So we look at those things. We receive federal funding. We go through extensive training. Again, we don't sell insurance. That's not what we do. We don't make a commission. It's not that we don't care what plan you enroll in. We want you to have the best coverage at the best cost. But we will never tell you this is the plan that you need to take out and this is the company that you need to go with. That's not our role. Okay. So I want you to know that you need some type of drug coverage no matter how you have your health insurance, because you never know when you're going to need a prescription. And the older we get, normally the more we need prescriptions. I speak to sometimes 80 plus and 90 plus year old people that don't take any medicines, or they take one. And I'm like, you're so fortunate, because that's not normally the case. So you need some type of drug coverage. And we need to make sure that that's going to work for you. It also matters what pharmacies you use, because if you use an in-network or preferred pharmacy, usually your costs are lower. When we go to the Medicare website and we compare your Medicare drug plans, we can key in up to 5 pharmacies, including mail order, and look at the different prices. And I'm not going to tell you what pharmacy to go to or not to go to, but if I see a red X, I'm going to tell you, you might want to look at that price. And if I see a green check mark, I'm going to tell you to look at that price and compare the two so that you can make the decision as to where you need to go to get your prescriptions filled. But don't get in a drug plan and stay there from year to year, because the plans change every year. And that's why the government gives us 7 weeks during open enrollment to allow us to compare and make those changes to start in January. If you have a Medicare Advantage plan, not only do you have 7 weeks in the fall, but you've got the first 3 months of the year that's called the Medicare Advantage open enrollment period. And you can make an additional change if you did nothing in the fall, or if you made a change in the fall, or if you didn't make a change in the fall, you have the first 3 months of the year. And we tell Medicare Advantage people that when they meet with us in the fall, that they have an additional 3 months in the first of the year if they want to change again even. So there are time frames, there's deadlines. It's just really important that if you have a Medicare product for your prescription drug coverage, that you compare your plans every year, because the plans change. It can give you better coverage. It can save you money. And I was looking at my dad's plan last year, and the plan that he was in 2023 was going to be the same plan that he should stay in for 2024. But when I looked at pharmacies, I said, Dad, look at these pharmacies and look at the ones with the green check mark versus the red X. and decide where you need to go to get the best bang for your buck. Because if you're on Medicare, you're usually on a limited income, and we want you to make use of that income that's limited and get the best product for the best cost. We can help you with that at no cost. Please reach out to us. Again, if you're a state retiree with the state health plan, please reach out directly to the state health plan. Their number is on everything they mail out. Trust me, I know, because I get the mailings as well. But let them help you, because they are the horse's mouth. They have direct information to give you. And I think that's everything that I wanted to mention. It's an exciting time. Just keep your eyes and ears open. You may get information from other companies that you don't have insurance with. If you ever see this symbol where my cursor is in the bottom, the eagle that's turning into a face, that's the Social Security Administration. Also, actually, that's the Department of Health and Human Services. That's their eagle. But if you see something that says Social Security Administration with an eagle on the outside envelope, that is the federal government trying to communicate with you. Please open that up and pay attention. The plan that you have now is going to send you between the end of September and the 1st of October, either one of two things: your annual notice of change that tells you about your current plan and how it's changing for next year. And the good thing is it's telling you about that plan for next year, but it doesn't tell you about all the other plans that are out there that may have better coverage for better cost. So that's why you need to do a comparison every year. Reach out to us for that. Or if your plan is not going to be around in your county or in the state next year, they may send you what I call a Dear John letter. It's a non-renewal letter telling you, thank you for your business in 2024, but we regret to inform you that we will not be around next year, and here's what your options are. So keep your eyes and ears open, and especially if you know it's from the state health plan or Medicare or Social Security, open those things up and pay attention. And if you don't understand, there's always a number there for you to call with questions. Daryl, Tracy, I'm going to bounce it back to you. I know we've got just a little time for questions. If your questions don't get answered, guys, again, if it's state health plan related, call the state health plan. The number's in the chat box. Or if it's Medicare related, reach out to SHIIP and we're happy to help you.
All right, thank you, Jeanie. This is a lot for a 1 hour sitting, but very important information. So everyone pay attention to the documents you receive in the mail, and Jeanie is going to provide us with some links as well. So when we send out the follow-up information, those links will be in there, and you can go back and look at this recording so it can refresh your memory as you are going through the open enrollment time period. Let me get to one or two questions in the Q&A. One of them, if you choose to work after 65, what should you sign up for? Parts A and B and D? Or just parts A and B if you
that is a
having
great question, Daryl. Thank you. And it's one we get asked often. As I mentioned earlier, this is a very detailed process and we don't want to miss anything, and people are all different. It depends on how many employees work where you work. It depends on if your insurance is going to be primary or secondary to Medicare. It depends on if your insurance at work is in the form of a healthcare savings account or HSA. So there's questions that we ask people to determine what their situation is, because we want to provide them with correct, accurate information. And so I would encourage you, if you're turning 65, about 3 to 4 months before that you reach out to the SHIIP office in Raleigh, the 855 number, or you reach out to your local SHIIP coordinating site if you know who that is, and now you know how to find it on our website. But there's different questions that we ask people. If there's over 20 or more employees, you may not want to take out Part B, because your group insurance is going to be primary, and it would be a waste for you to pay $174.70 a month for Part B to be secondary when it might not pay anything or pay much at all. But if you've got a healthcare savings account, you might not want to take out Part A either because of the tax repercussions and the penalties. So rule of thumb is about 3 to 4 months before you turn 65, because everyone's different. Reach out to SHIIP and we can help you individually, and we will know what questions to ask you in that screening process. We've got
Okay.
a document called the Road to Medicare. It's a 4-page document that has all the enrollment periods. It's great, but we've taken it down because there's a section we need to revise. And at some point, that'll be back up once it's finished under construction. But your best bet is to reach out to us about 3 to 4 months before you turn 65, and we can help you no matter what your situation is.
Hey, thank you, Jeannie. We don't have any time for further questions, but I do want to ask one. A person indicated that I believe, lives in South Carolina, but she gets her Medicare and everything from North Carolina. So should she contact the SHIIP person in
Well,
North or South Carolina?
that's an interesting question and comment.
Yes.
Normally, your Medicare is based on your residence, and that's what's on file at the Social Security Administration. So, if it were me, I would reach out to Social Security and make sure that they have your current, accurate residence address of residence, because if you're formerly living in South Carolina, those are the Medicare products that should be looked at, not North Carolina, where you receive services maybe. So it's based, and that's a great question. It's
Yeah.
based on your zip code of residence as to
Yeah.
which Medicare C and D products are available,
Yeah.
not where you receive services. So make sure that your address is correct with Social Security, and hopefully that will work itself out.
And there's several more questions, and I would just suggest that everyone follow the links that Jeannie has suggested to get those answered if we were not able to answer them today. So I have a couple of reminders. But before I do that, Jeannie, thank you so very much for this information today
And
and taking
Daryl,
the time with us. Yes.
if you wanted to at some point, I know Senior Medicare Patrol is doing a lunch and learn maybe sometime next year, but if you
Yeah.
ever wanted to do just a Q&A for a lunch and learn, I'm happy
Yeah.
to do that after open enrollment's over. So let me know, because I know there are a lot of questions, but you
Okay.
have a resource to call, and that's the main important part.
Okay, good. Thank you again so much, so much. So I just have a couple reminders. Don't forget to complete the survey. We will be sending you later this week. And again, it's quick and easy to complete, and we need your responses back by Monday. Before we leave, note that our next Lunch and Learn webinar will be held on October the 16th from 12:30 to 1:30. It will be presented by David Kirkman, formerly of the North Carolina Attorney General's office and author of Elder Fraud Wars, Case Histories from an Enforcement Attorney. You will not want to miss this, because he's going to make you aware of what's going on out there now and how to protect yourselves against fraud and scams that particularly are directed at our older population here in North Carolina, as well as across the country. So, ladies and gentlemen, thank you again for joining us. And as always, the association stands ready to assist you in your retirement. Please call us if you need us. You can reach me at Daryl, DERYL, at ncrgea.com, and I'll be happy to see if we can get the question answered. So have a good day, a nice afternoon, and goodbye. Thank you for coming.